Scheduled programming with breaking news out of Huntsville.
Top health officials are about to give us an update on COVID-19 spread and mitigation efforts happening right now in our community. Let's listen in live.
Our speakers today will be Mr. Jeff Sams, CEO, Huntsville Hospital, Dr. Aruna Aurora, President of the Madison County Medical Society, and Dr. Rachel Ballard, Director of Equity and Innovation from the Madison County School System. At this point, I'll give the current numbers. In the state of Alabama, there are 757,893 cases of COVID-19. In Madison County, so far, 47,738 cases, having resulted in 562 deaths so far. Also, current positivity rate for Madison County is 19.7%. At this point, we'll go to our first speaker, Mr. Jeff Sams from Huntsville Hospital.
Thank you, Jeff. I'll share our numbers first. In Madison County, our two hospitals today have 184 inpatients, 49 of them in the ICU and 37 on a ventilator. 2 weeks ago when I was here, the number was 208. So we have seen a decline of approximately 10% in the past 2 weeks. Crestwood adds an additional 37 inpatients today, 8 of those in the ICU and 4 on a ventilator. We are very pleased to see this modest decline, and we hope it means we're passing the peak of the surge. There's still a lot of stress on the healthcare system, but it's the first day where I have felt like perhaps we're rounding the curve. Within our healthcare system together, we have 391 inpatients. 2 weeks ago, that number was 415, so a similar decline. There are 112 across our system in the ICU and 87 on a ventilator. Of these inpatients, 86% of them are unvaccinated. The average age is 62 years old. We have 8 pediatric patients in the hospital with COVID. 2 of them are in critical care, and we have 5 pregnant inpatients with COVID, and 2 of them are in the ICU. In the past 2 days in our hospital, we had 7 deaths due to COVID. The stress on the system remains very significant, and we cannot perform inpatient elective surgery at Huntsville Hospital, Madison Hospital, and most of the other hospitals in the system. That's been the case for probably about the past 6 weeks. All of the staffed hospital beds are full in our healthcare system, and we are routinely holding between 50 and 100 admissions in the ER. That's been the case for a while. That's nothing new, but just an example of the stress on the system. So when the hospital staff beds are full and the ERs are holding that number of patients, there aren't as many ER rooms for ambulances and people who may walk in the lobby. So you may experience longer waits in the ER waiting rooms, and that can cause delays for EMS being able to unload their trucks as they're waiting on a room to open up to have a place to put the patient. So just an example of the cascading delays that occur. And we very much appreciate the community's patience and support as we work through that. We continue to restrict visitation, generally to 1 visitor, and I'll also continue with the themes. If you feel sick, strongly encourage you to not wait it out, to go get tested, quarantine, and we'll remind everyone again that masks continue to be a very effective tool to protect your friends and family. We have shared a lot of information about COVID and will continue doing so. We want to share the impact of COVID on the hospital because we believe the community should know the status of these resources and be well informed. We will always be here to take care of everyone equally to the very best of our ability. COVID vaccination is a deeply personal choice. We share our experience with the vaccine because we want you to be able to make the most informed decision for you and your family. In our experience, the vaccine is very safe and very effective, and we believe it is the best way to protect you. There's a lot of misinformation out there. If you have questions, please ask an expert, and we encourage everyone to talk to their doctor. Finally, to our staff continue. They're tired, they're heroes, and we appreciate them so much for continuing to step up. My sincere and heartfelt thanks to the doctors, nurses, therapists, and support staff who continue to step up month after month. I look forward to questions, and thank you, Jeff.
Thank you. And now we'll go to Dr. Aruna Aurora from the Madison County Medical Society.
Hello. I just want to come here and mention that we are truly grateful for those who have gotten their vaccine. From the last time that I was here, the numbers in our state are going up. Whether that's because you have gone and seen your doctor and asked important questions, or whether you've had somebody in your life that has been affected by this virus in a bad way. It is hopeful, it is reassuring. Our system, as Jeff has just described, is overwhelmed in a way that we have never been before. When the hospitals are in burden, so are the outpatient clinics. They are managing patients who are a lot more serious to keep them from going to the ER and waiting in spaces that are not best for them. So this really is a community-wide effort. We appreciate that people are wearing their masks in the community. By taking this seriously and coming together and knowing that citizenship is not just your rights, but also part of us being responsible, is really what's going to help us through this as a state. I know we have talked about the various treatments. If you do get COVID, the monoclonal antibodies, that is a wonderful treatment as long as you get within the window. So making sure that you get that treatment within the 10 days to keep yourself from going to the hospital with problems of shortness of breath is really important. I'm here to share some bad news. For the first time, we've been told from the federal government that our amount of monoclonals will come down that we are given. We have a call statewide tonight with all of the physicians to describe the new process. The monoclonal antibodies will go to the state public health department, and then the state public health department, just as they distributed vaccines, will distribute these monoclonal antibodies. And so not to scare anybody, because we will still get the proportion allotted depending on hospitalizations and cases per state. And so as you can imagine, there are about 6 to 7 states that will continue to be ahead in the need and demand for this treatment. But it should just make us realize that the monoclonal antibodies are here for us if we need the treatment. But really, the only way through this is for us to get the vaccination. And so if you do have any questions, if you've heard the misinformation, which is oftentimes louder than the correct information these days, just know that your physician is there. Any physician is there to answer your questions and hesitations. Thank you for doing your part as a community.
Thank you, Dr. Aurora. Now we'll go to Dr. Rachel Ballard from Madison County School System.
Well, good afternoon. We were thrilled to start school with students in our classrooms this year for in-person instruction. Parents also had the option of choosing our Madison County Virtual Academy if that was the best option for their family. And so our two primary goals this year, number one, is to keep our students and staff safe, and to also keep students in school for in-school instruction. We started school on August 4th on level 1, mask optional, as outlined in our Ready, Set, Forward plan found on our website. Quickly, our COVID positive numbers among students and staff began to increase. We then moved to mask required in both our school buildings as well as buses. Our highest number of positive cases posted on our dashboard was on August the 25th, with 641 positive students and staff with COVID-19. However, this afternoon, on behalf of Superintendent Perkins, I am pleased to share that we have seen a decline in the number of positive COVID-19 cases amongst our staff and students. Last week, last Wednesday, there were 302 positive cases, and as of this morning, there are 201 positive cases amongst our students and staff. So we are very thankful for the cooperation from our staff and students, and we hope that we will continue to trend in this direction. Also, every Wednesday at 4:00 p.m., our COVID-19 dashboard is available on our website at mcssk12.org. And we encourage you to view that dashboard for more information. As a reminder, we're continuing with our safety protocols as outlined in our Ready, Set, Forward plan. And lastly, this is our third academic year managing through a pandemic. And with that, we want to acknowledge and thank our parents for their continued support. Thank you for entrusting your most precious gifts to our care as we partner with you in your children's educational journey. We believe in loco parentis, that we stand in the place of the parents, and we take that responsibility very seriously when your children are in our care. We also want to acknowledge our teachers who have tirelessly worked to ensure that our students are still learning at high levels. So thank you, teachers, and our support staff, our school nurses, our bus drivers, our social workers, our child nutrition workers, our IT services department, and other supports. Thank you. To our administrators, they have served with servant leadership and with great integrity. And to our two sistering school systems, Huntsville City Schools and Madison City Schools, thank you for the collaboration and partnership. And last but not least, we are on a mission to educate the whole child, and we cannot do that without our community. And we are blessed to live in Madison County, where our students have access to opportunities that some other places and some other students do not have. We're on a mission to eliminate any barriers that may cause students not to learn at high levels. And so we want to thank our community partners, our volunteers, our faith-based community, our nonprofit community, and our business partners. You have come alongside of us and supported us in tremendous ways. And with that, we are extremely thankful. Thank you.
Thank you, Dr. Ballard. And thank you for watching today. Our next scheduled briefing is next Wednesday, September 22nd at noon. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Good afternoon, Dallas Parker with News 19. This question is for Mr. Sams as well as Dr. Aurora. We talked a little bit about there's going to be a meeting later today. We're discussing the monoclonal antibody cutback. What do we anticipate this looking like as far as the impact on clinics and treatments availability for Huntsville Hospital and Madison County-wide?
So we anticipate not being able to meet the full demand. So we don't know how much, but we know our allocation will be reduced. So our response to that, we have already started trying to create prioritization in the system so that the most vulnerable patients receive the monoclonal antibodies. So we're going to look at the age and comorbidities, how likely you are to be hospitalized, and try to make sure that the patients who need it most receive the medication. We will also continue to advocate in every way we can to make sure this community gets a full share and everything we're due of the monoclonal antibodies. But the initial response will be to try to make sure that the right people who need it most get the treatment.
Did you want to add to that?
Jeff is correct. We'll certainly advocate for our region of the state to continue to give monoclonal antibodies. We have been giving it extremely well and successfully. The family doctors, the primary doctors who are finding that they have a COVID patient and then referring, the processes work so smoothly here, and we do not want to interrupt this. We are certainly realistic in some of the distribution that could be coming down from the Department of Public Health to the various regions and the places of need. But because this should follow a pretty protocoled process with proportions of cases, I think we should be able to meet our needs.
Gotcha. My follow-up question is just, we're 18 months into this pandemic from the first state of emergency from Governor Ivey. How do you think these 18 months will be remembered in the future? And that could be from a historical standpoint and even from the school side, textbook standpoint for the next generation.
Yeah. It's almost hard to say. It's hard to believe it's been this long. It's once in a lifetime pandemic, I hope. So I think we're going to remember it with the the fear of responding to something unknown, the incredible outpouring of community support the health system has received. I can't tell you how much it means when people call and send messages. Initially, it's the adrenaline of responding to a crisis and the warmth of responding to it. And at this point, I think we've reached the phase where we're all just ready to move on. You know, everybody is tired. But we're here to take care of people. So everybody's going to continue. Come in that ER, you're going to get taken care of to the best of our ability, no matter who you are, where you came from. It doesn't matter. We're going to respond to everybody. So people will keep doing that, but they're tired. And I think we just ask the community to please consider doing your part to try to get a community-wide response that can put an end to this and get back to normal.
Thank you.
Yes, Madison Scarpino from WAFF 48 News. My question is for you, Mr. Sams. I had spoken with some Huntsville Hospital nurses who were pretty upset about just their pay and compensation. I believe it was less than $24 an hour starting pay, lower than a lot of places nationwide as well as the state. Just based on the circumstances at not only Huntsville Hospital, but hospitals nationwide, will you or have you considered raising the salary for the nurses?
We raised salaries for nurses approximately 6 months ago across the board. So we recently did a market adjustment, and we look at a lot of variables when we consider pay for nurses. The reimbursement for healthcare is less in Alabama, and it kind of follows that sometimes salaries, not just for nursing, but across the board, sometimes those are less. We have offered, we have chosen to use incentive pay and additional pay for people who are willing to work extra and respond to the crisis. And we have offered that to all of our staff. And we've tried to make sure that when we have those extra payments, they're going to nurses who work in our hospital who want that extra money. So I don't know that we'll ever achieve a point where everybody is going to agree that they're paid enough. But we are trying to stay very competitive for nursing salaries. And we're also trying to make a big effort to make sure that when we have additional pay that might go to a traveling nurse or an out-of-town nurse, we try not to do those things. We would much prefer that the nurses who live and work in our community get those extra payments we make for working the extra shifts.
And with that being said, my follow-up question is, those travel nurses that you guys do bring into Huntsville Hospital from elsewhere, what is their salary compared to starting of a regular nurse at Huntsville
We have
Hospital?
not used traveling nurses at Huntsville Hospital. We think it is, we've just chosen not to use those because we don't think it's fair to ask our staff to train and orient somebody who's coming from out of town making a lot more money than they are. So we take the resources we would spend on travelers and we give it to our nurses who are willing to work extra. It's not perfect. I understand when hospitals resort to using travelers because you get in a crisis, you're looking for anything. But in our case, we have been able to get through by rewarding our nurses instead of travelers.
Thank you.
Hi, Alexa Scott from Channel 31. I just wanted to ask, because you all made a big statement to me as far as our EMS services and how they may have the backup in our ERs and whatnot. Can you talk a little bit more to what that delay looks like? Are they those patients that are getting in hopefully first, or what does that process look like for you all?
So when you come into the ER by ambulance, you're kind of going to the front of the line. But if we don't have an empty ER room to put you in, we have to hold that patient with the EMS personnel until we have a place to unload. That is traditionally a problem that our ER staff work through on a daily basis and are able to kind of massage the system and find places for everybody. It just becomes much more challenging when the whole hospital is full and the whole ER is full, and that's that situation a lot. Now, it's all hands on deck to manage that. So HIMSI and many others step in to provide additional staff to try to unload those patients and make sure we're not holding that ambulance up. So there's a tremendous team effort to respond to it. But it's just a practical matter when you come off the truck, even if your first priority, if there is not an empty room in the ER, you're going to be parked in a hallway while we work on massaging the system to find a spot for you. Incredible team of people that make it work, but it does slow things down when things are full.
Thank you for answering that. My follow-up is actually going to be about a patient that we saw who passed away, who not here in, Huntsville or Madison County, but he was looking for care. How can we tell people that they will be taken care of when our hospitals are inundated right now?
Everybody's working so hard to make sure people get taken care of, and we do our very best to maintain. The reason, for example, we've canceled our inpatient elective surgery is to reallocate those resources so we can respond to an emergency when it comes in. Emergency departments and hospitals are very good at triaging things. So when you have the most emergent condition, a trauma or a stroke or a heart attack, you're going to go to the front of the line and everybody's going to make it work. So there is a tremendous effort to make sure those resources are still available and those protocols work. But they are stressed when not only our hospital, but all of them are feeling the strain. And if it's a patient beyond your capability, there may be delays in finding a higher level of care. So I can't assure you there won't be any delays. It's just a practical matter of the stress on the system. But I can promise you everybody is doing everything they can to make sure every single patient gets the best care.
Thank you.
Okay, so, Nixon Norman with Fox 54 News. And this question is for you, Aurora. And I'm saying that correctly, right? Perfect. So the monoclonals, there's obviously this cutback. Is that because there's a shortage of these things? And furthermore, is that because people are using these treatments as a way of being treated as COVID instead of getting the vaccine? And one second, let me put my camera on you.
The answer to that question is there are about 6 or 7 states that are using the largest proportion of the monoclonals. It's not so much a supply issue, it's just an allocation choice that has been made by the federal government. About 6 weeks ago, we were approached by HHS to encourage the use of monoclonals. And so we did have some meetings about giving, the information to our doctors about the subcutaneous injection of the monoclonals, which they had wanted us to promote to keep, patients treated, especially as hospital burdens were being seen. So we were a little surprised when a week ago we were notified, that we would like to kind of slow down the process. And that's really essentially the message that was given. We've been fighting hard back to that because we still have patients to take care of. We have hospitals that are overburdened. Even our non-COVID patients are being affected by this, as we now know. So this is not the time for us to take away a treatment that we know can work for our patients. And so we've, at the congressional level, we've had people, express our concerns as physicians for the best treatment that is out there for patients who have COVID. And so what we are doing now is simply letting the process unfold. We've been reassured that because the proportion will go according to cases and hospitalizations in the community, we will be served with the same amount. But if there is a point that we have more demand than we have supply, we will, of course, readdress this issue as it is an evolving one.
It's not a supply issue, and you may not know the exact answer. Why are they, cutting it off? Why are they lowering the supply?
Well, that's a good question, and I don't have the answers for that. I suspect that all the states are going to be needing, monoclonals as well. And so, for the number of states that are proportionately, getting the high number of monoclonals, and there was a number that was told to us, they just, wanted us to be, to really allocate and tell them where this was going. I think in the process, they weren't getting the feedback on where these monoclonals that they are giving are going when they were giving it to providers. And so now the solution is to give it to the state, and then the state be responsible to report back on how the monoclonal antibodies were used in the state. But yes, it is certainly an issue that we are proactively staying on top of, because our hospital systems are not any less full. And as you heard Jeff say, inpatient electives, are still canceled. And so, there has to be the ability to treat patients in a non-hospital environment.
At this point, we'll end the press conference. Thank you for coming.
You've been watching Huntsville's COVID-19 briefing. Now, a few interesting things they mentioned had a lot to do with the monoclonal antibody treatment. They said that you need to get it within that window of 10 days that you are infected. Another interesting point that they made was that the federal government will have control of how that treatment is distributed across the country. So that is something health leaders in our area are meeting tonight about, to figure out how they're going to distribute that. And it will be given to ADPH for them to distribute across the system how they feel needed. Matt.
Olivia, also some positive news coming from hospital leaders telling us that we may be reaching the top of the surge right now in Madison County. They're saying within the last 2 weeks, we've seen about a 10% decrease in the number of people coming in and needing help from COVID. So some possible positive news as they look ahead to this surge that is definitely filling hospital beds across Alabama right now. They're doing everything they can to keep up with the number of patients. We want to get you back to normally scheduled programming. This has been special coverage from Madison County of an update with COVID-19 mitigation efforts underway right now in our community during this pandemic.